integrate our response into routine health services. Liberia avails herself to additional experience and is willing to share her experience. Thanks, Madam Chair.
Thank you very, very much. We move straight now to hear from the ministry in Kenya.
Thank you, Potua. The Republic of Kenya would like to thank the Secretariat for organizing this special event on the COVID-19 response in the African region. The world continues to face unprecedented difficult times due to the ongoing COVID-19 pandemic, which has continued to devastate lives and economies, as well as disrupting the way we live and introducing new normals. Chairperson, Kenya recorded his first case of COVID-19 on 13th of March 2020, and as of 24th of August, we have recorded 32,557 cases, unfortunately with 554 deaths, giving us a case fatality ratio of 1.7%. We have conducted more than 430,000 tests spread across 34 laboratories in the Republic of Kenya. Like other countries, we have put in place various intervention measures, and we have begun to see the fruits of these measures as the cases have begun to decline. Madam Chair, Kenya is fully committed to providing our share of support towards COVID-19 response measures within and beyond our region. Our scientists will in the next few days be conducting local trials for one of the vaccine candidates, which has already reached phase 3 trials in the United Kingdom, Brazil, and South Africa. In addition, Kenya has contributed 50 multidisciplinary team of healthcare workers to support the surge capacity in Seychelles. In conclusion, Chairperson, Kenya wishes to applaud WHO for the critical role played in providing technical leadership and mobilizing resources from partners to facilitate timely containment of this pandemic. We are calling for collective efforts from all member states in tackling these menace. I thank you.
Thank you very, very much for that. We move now to hear from Mali. Over to you, Minister. Mali, are you with us? And perhaps you need to unmute.
Bonjour. Le Mali est là?
Yes, Mali is here.
Madame la Présidente.
Madam Chair.
Madame la Directrice Régionale de l'OMS,
Regional Director, Honorable Ministers, distinguished delegates, ladies and gentlemen. First, on behalf of the government of Mali and the authorities of our country, I would like to express our sincere gratitude to the WHO for its leadership through the RD, Dr. Moeti, as they supported us as we deal with this unprecedented global health crisis. We thank the RD for the clarity of her report. My country is deeply committed to the implementation of the universal health coverage. We also intend to respect the Mali Action Plan, especially with the 5 pillars relating to health. We also like to thank the other countries for their support. COVID-19 came up at a very difficult time for our country. For more than 8 years, Mali has been confronted with an unprecedented security crisis, which has destroyed the health facilities and displaced the populations. This means that we have both insecurity and vulnerability, and it was in this context that this virulent virus, COVID-19, was notified by the WHO. To date, we have had 2,700 cases with 135 deaths. 2,800 have been healed. All these cases were taken care of in the isolation centers. But even before the first case was identified in Mali on 25th March 2020, the government had initiated a national response plan with the support of the WHO and the international community. It was a multi-sectoral effort for 52 million euros, which strengthened control measures at borders, emphasized a communication strategy, as well as a system for tracing contacts and care for patients.
Thank you.
The funds were also used to ensure that capacity was made available to the healthcare workers. We asked Malians to ensure physical distancing, but we realized that it is very difficult to lock down a community of persons living under precarious conditions. We commend the Malians for their efforts to fight this pandemic. The entire country adopted the program of immunization by 2020, and I thank you for your kind attention.
Thank you, sir. I go now straight to the Minister of Health, Guinea-Bissau. Guinea-Bissau, are you with us? And after Guinea-Bissau, we shall hear from Sao Tome and Principe. If you would be please ready, Guinea-Bissau, over to you. Minister, please unmute. Guinea-Bissau, the floor is yours. I think there may be a problem. We can come back to Guinea-Bissau. Let us go to Sao Tome and Principe. If you are ready, we shall hear from you. Minister?
Government of Sao Tome and Principe would like to greet the regional director of the WHO AFRO, as well as all its staff, and would like to congratulate you for the organization of the 70th edition of the WHO AFRO RC meeting. The document RC70/70 talks about the scope of the COVID-19 response in our country, has had to take various measures and various decisions with regards to our contingency plan. We have got a crisis response plan that is led by our Prime Minister, and we have also declared a state of national disasters. We've carried out various awareness campaigns through radio and various other measures. We've also trained our healthcare workers so that they can understand the reality of all COVID-19 cases. There's the mandatory use of masks, as well as washing of hands and social distancing. And we also have required people to isolate themselves if they have any of the symptoms. There's also accountability in all areas. There's the daily information on radio, television, and newspapers regarding COVID-19. The ministry has created various multi-sectoral teams to follow up on home-based care and treatment of patients, as well as providing food coupons and support to people. It is sometimes difficult to detect early and isolate cases, as well as do contact tracing, but we are trying in this area. And we're also using our community health workers so that they can ensure the surveillance of all patients at risk. The Ministry of Health and WHO have supported the training of staff in the area of COVID-19 response. The United Nations systems agencies, as well as bilateral, multilateral organizations, various personalities in the country are all involved in our COVID-19 response and in strengthening the efforts of our national health system. It is also important to say that all the results that have been obtained thus far are as a result of the involvement of everybody, especially our government organs that have been involved since the beginning, as well as our President of the Republic. So on behalf of the government of São Tomé and Príncipe, we would like to thank all those that have supported us in our efforts. At the moment, our challenge is in trying to coordinate all efforts and interventions to try and strengthen leadership as well as the ownership of all these programs so that we can respond properly. It's also ensuring proper financing, ensuring that we get all the funds that have been pledged. I'd like to specifically thank our population for their behavior, as well as our armed forces, our security forces, and all our health professionals. It is due to them that we can survive this crisis. Thank you very much, and good luck to all.
Much appreciated. A reminder to all who are still to speak to please keep within the 2 minutes. Otherwise, we will have a challenge doing what we need to do before we close the session. Guinea-Bissau, Minister, over to you.
Excelentíssima Senhora Ministra da Saúde,
Your Excellencies, the Minister of Health and Population of Congo, Chairperson of the current session, Honorable Ministers and Heads of Government of Congo and Mauritius, Regional Director of WHO Afro, and distinguished ministers, representatives of the different institutions and organizations present, distinguished ladies and gentlemen. At the outset, allow me to thank the opportunity that is provided to me to participate in this 70th session of the WHO Afro Regional Committee. And I'd like to specifically thank the Minister of Health of the Republic of Congo. With regard to the COVID-19 pandemic, which continues to concern the entire world and particularly our country, and in the absence of a vaccine or adequate therapeutics, it has now been 5 months since the declaration of the first state of emergency in Guinea-Bissau on the 27th of March 2020. This state of emergency has been renewed 7 times, and I'd like to share with Your Excellencies what is the current epidemiological situation in the country. We have got 2,200 positive cases and 34 deaths. During the COVID-19 response, the weakness of our health systems, we have never been isolated. So we've received support. We've also received strong leadership from the President of our Republic, and we've also received support from ECOWAS, from the African Union, from the WHO, from the European Union, and all our neighboring countries and friendly countries, especially Turkey and Senegal. Ladies and gentlemen, the COVID-19 pandemic is far from being controlled all over the world, and Guinea-Bissau is no different. So this requires us to reflect very seriously and to take on board empirically based and evidence-based responses, especially with regard to the area of transmission and infection. It's also important for us to ensure proper use of all preventive and barrier measures to ensure greater accountability and better behavior by our communities. I'd like to conclude my statement wishing all of you fruitful discussions, and may we succeed in our efforts against COVID-19 pandemic. Thank you very much.
Thank you for that. I see the Minister of Health Burkina Faso is ready. Madame, over to you.
Yes, merci. Honorable participante, honorable. Je salue la tenue de cette
participants, I commend the holding of this 78th Regional Committee for Africa in this environment of the COVID-19 pandemic. I would like to congratulate and thank the WHO for its involvement from the outset of the outbreak through technical and financial support for countries, all of which made it possible to come up with response plans as well as training of health workers so as to limit the cases of infection, which is 114 when Burkina Faso with no deaths from the outbreak. I acknowledge the regional collaboration under the leadership of the African Union, ECOWAS, and of course the support of WAHO. I commend the ownership of the response by the authorities of my country, starting with the head of state himself, who called for unity of action at national level. And we responded. The private sector and other development actors were involved alongside the Ministry of Health. It was the private sector that supported us in the manufacture of masks with Burkina Faso cotton under the technical guidance of the Burkina Faso Association for Management of Quality. We commend the contribution of all partners who helped us to ensure continued health services throughout the pandemic. In particular, we have the precious presence of the WHO rep in Burkina Faso who supports us as we deal with the pandemic all over the country. For the strengthening of the health systems, Burkina Faso notes the need for better ownership by the countries of the COVID platform, the content of which should evolve alongside as knowledge on the disease is known. Burkina Faso goes along with all the initiatives and recommendations that will come out of this session. I thank you.
Thank you very much, Minister, for that. I come now to DRC, and straight after that, we shall hear from Nigeria. Please be on standby, Nigeria. Over to you, Minister of Health for DRC. Thank you.
Cher directeur de l'OMS,
WHO Regional Director,
Leurs Excellences Ministres de la Santé,
Honorable Ministers of Health,
Madame la Directrice Régionale de l'OMS,
Regional Director. In my country, the outbreak started on 10th of March 2020. To date, we have had a total of 9,800 confirmed cases, one probable case since the outbreak. We have had 251 deaths. That is a global mortality rate of 2.6%. The capital, Kinshasa, remains the epicenter with 80% of cases.
National.
Province, which accounts for 6.1% of cases. Information available in utilized and 526 with mild symptoms and 3 with moderate cases. To date, we have not had any declared cases of severe cases, but we do have some major challenges. One is the decentralization of laboratories for diagnosis. 2, management of travelers. 3, double outbreaks. As you know, in DRC, we have both the COVID-19 pandemic and the Ebola epidemic in the Equator province. In line with the decentralization of laboratories, we have already started this to other provinces, particularly North Kivu, Lubumbashi, and Kisangani, as well as with regard to decentralization with respect to COVID-19, efforts have been made to improve the process, as well as diagnosis capacity, and the time it takes for the results to come back. COVID tests are required with 3 days before travels. With regard to Ebola in Badaka, we have already come up with an integrated Ebola COVID-19 response plan. Thank you.
Thank you. Thank you very much. Fantastic to hear there's an integrated response plan. I come now, this is the final statement from Nigeria. Minister, over to you.
Thank you, Madam Chair. Nigeria wishes to acknowledge the efforts of the WHO African region in supporting her states, especially Nigeria.
C'est vrai, mais pourquoi il a parlé?
During this COVID-19 response.
Oh.
Confirmation.
Ok, ça va. Ça va. Merci. Merci, voilà.
May I request that the DRC Minister, would you please mute? Please do mute.
Sorry.
Thank you. Nigeria, back to you.
Thank you. Nigeria wishes to acknowledge the efforts of the WHO African region in supporting her states, especially Nigeria, during this COVID-19 pandemic response. You will recall that following the confirmation of the new virus, Nigeria established a level 3 COVID-19 Emergency Operations Center at the Nigerian Center for Disease Control. She also established the Interministerial Coordination Committee on the response. However, following the declaration of a pandemic, the Nigerian government upped her response by establishing the Presidential Task Force on the COVID-19 response, which mobilized both human and material resources and provided strategic coordination of a whole of government approach towards the pandemic response. This gave this response the highest level of political support. This made the establishment of the PTA gave this response the highest level of political support. However, in order to adequately respond to this pandemic, we have also mobilized and established unprecedented strengthening of the response infrastructure. For instance, Nigeria has gone from 3 laboratories at the beginning to over 64 laboratories. We have also established positivity ratio from 19.7 and reduced it to 13.9 in August. The number of states with testing capacity has also increased from 2 at the onset to 32 out of the 36 states and the FCT. The average testing capacity has increased from 500 to over 3,500 per day. In addition, we have recorded several achievements, which include, of course, the development of the National Strategic Health Sector Pandemic Response Action Plan with the support of the WHO and other partners. In moving forward, we are looking at further improvement in the testing and treatment for the pandemic. We're also looking to increase and intensify risk communication, implement targeted subnational response, ensure transition planning, and operationalize the National Pandemic Response Action Plan.
Thank you.
Nigeria is willing and available to share her experiences with other countries in the African region. Thank you.
Thank you so much, Minister of Health Nigeria. They're closing out the statements. And just a change in our program, we will not be able to do the panel session justice, and we must move from this session to the next. So I believe it will be scheduled later. I want to hand back to the chair, but just as I do that, just hearing the comments from all our ministers, it is clear that there is more than ever before a leadership commitment and an opportunity to put health front and center on government priorities and really to build and strengthen public health systems. It has been repeated across the board. This is required. So now maybe more than ever, it's our chance to get it right. As I said earlier, never let a good crisis go to waste. How do we build resilience and improve our health systems? Also, just to point out, it is clear that the multi-stakeholder collaboration, the effort, the work at continental level, at national level, and at community level has been incredible. Needs to be continued, maybe intensified. But with that, Madam Chair, let me come back to you. Thank you.
Merci infiniment, Julie.
Thank you very, very much, Julie, for the high quality of the debate. This was a very passionate and interesting debate. Congratulations on all for a very lively working session. We now need to give the floor to the Ministry of Health of Equatorial Guinea, who was the last to ask for the floor. Before we close the session, Minister of Equatorial Guinea, you have the floor. Thank you very much, Madam Chair. Madam Chair, Madam Regional Director of WHO Afro, heads of mission, ladies and gentlemen. Since the 13th of March 2020, we have had 4,926 cases with over 3,000 people who have recovered and very few deaths. More than 90% of cases are asymptomatic, and there are still 900 cases active right now. 5,000 PCR tests have been carried out since the beginning of the pandemic, and 350 tests per 10,000 inhabitants. Madam Regional Director, Madam Chair, we would also like to signal that the rate has come down from 10.7 to 3.7 in the last few days. We have strengthened our laboratory capacity in the last little while by acquiring further PCR equipment and reinforcing our capacity so we can carry out 1,500 tests per day. After mass testing campaigns, on the 27th of August, we will be beginning a mass testing campaign. And we have been able to do this thanks to the decentralization of our response. We have also strengthened our response capacity by creating isolation facilities. And we have also set up an adequate treatment protocol. Madam Regional Director, we would like to thank you for the quality of the support offered to us by the WHO. We had an incident manager as well as 4 international consultants who have helped us deal with the COVID-19 pandemic in our country. In conclusion, we would like you to know that our strategy now allows us to publish daily data on our health ministry website, and we also carry out regular updates between the WHO and our ministry. Thank you very much. Thank you very much, Minister. At present, I think what we will now have to do is have a short 30-minute break, perhaps a little less than 30 minutes, because we now have a shorter period of time available to us for the break. Our work will pick up again with the celebration of certification of wild poliovirus eradication in the African region. Given the fact that there is very little time left, we will now interrupt our work and to do with resilience.
All right.
Right, we've lost that link. However, that was the end of that briefing wherein the different countries on the African continent were giving their feedback in terms of the COVID-19 response. So, yeah, you had countries, of course, making presentations there as to how they went about to tackle this pandemic, the challenges that they faced, and the strides that they were able to make through the past 5 months. Okay, so we are going to take a quick break here on SA Today. More news for you shortly. Stay with us.
It's something we don't like to talk about, and very often we don't plan for it. But everyone deserves a dignified farewell when they pass away. A funeral plan doesn't have to cost a lot of money. Outsurance has a solution that's available now. A flexible, low-cost funeral plan that's helpful in life. The Outsurance funeral plan suits all your needs. It offers value, it's dependable, has benefits, flexibility, trust, and dignity.
One, two. This is a test. Can you hear me? 1, 2.
Are you talking to me?
Yes. If you are answering, is that you can hear me. Thank you very much. This is Geneva HQ doing a test.
Thank you. Yes.
Right, so it's the president of Nigeria who's coming to talk to the police.
Hello? Hello, test your mic. Can you confirm hearing me, please?
Yes, we can hear you loud and clear.
All right. Thank you very much.